Dear friends, welcome to the third episode of Varicose Vein video. In this video, we will be discussing on the effective management of varicose vein as per Ayurveda.
Our principal approach towards chronic venous insufficiency is Sira is the upadhatu of Rakta. So that means when the dhatu is properly functioning, so upadhatu will also functioning properly or nourished properly, or it can be rectified normally. That means we can't directly go and treat the Siras without treating the Rakta. Similarly, the Panchakarma, when you are looking, if Rakta Dhatu formation is optimum, if the Rakta Dhatu Agni is good, then only the Sarakita Vibhajana happens and Sukshma Bhaga will, proper Sukshma Bhaga will go to the Mamsa Dhatu, and then Mamsa Dhatu Agni will work, and then it starts. When you see the Pratiloma, Anuloma, Kshaya, always the before and after Dhatus are getting affected. This is how the relation is there. So, optimum Rakta means optimum Rasa also backside, and that will lead to the strengthening of the Mamsa Dhatu. Tunica media, as we told, muscular layer, that is once again what we say it is, comes to the Mamsa Dhatu. In that we try to look into one more point. Sthiratva is a function of Asti Dhatu. That means Sthiratva of the muscles, if it is lost, Asti Dhatu function is lost in Mamsa Dhatu. We believe that every Dhatu has Sapta Dhatus in it. Then only they can perform. Otherwise, one single or like a imaginary one single Dhatu with only one element, that cannot function. There are Panchakarmas which we do it in the case of varicose veins, atherosclerosis, DVT, hyperpigmentation, and cellulite ulcers are these conditions. So this is once again, it goes to, especially when we do the Panchakarma, maximum we go with the either Rakta Mokshana or with the Virechana. Some cases we go with the Vasti, where the abdominal causes are the real causes for the varicose vein. That means when we are opting Virechana, that means Rakta, Pitta, liver, spleen, bone marrow, blood vessels, heart. We are covering almost all the areas which are formed by the influence or the presence of Rakta into that. Or Rakta Vashrotas, we can take that part also. So that means Panchakarma is also intended to look into the area where the Rakta or Rakta related components are rectified to do their best functioning. In case of stage-by-stage treatment, if we are looking, first and second stages, that's a reticular vein and spider vein, Jaloka will be the best because it reduces the swelling and it can improve the microcirculation, and it has an anticoagulant, all of us know, so it becomes a blood thinner, so that if there is a clogging somewhere else, that will be released so that the flow happens much more easily. In case of third stage, where the varicose vein has manifested, then we have bloodletting or Rakta Mokshana. I don't think practically it is a treatment for varicose vein, because it's only helps to relieve the pain, heaviness, muscular cramp, and paresthesia. All this happens because of the stasis of the blood. That is like a mechanical pressure which is built up, leading to all these things. So, but it is required sometimes where these are the main complaints by the patient. Otherwise, I don't think there is no much importance for this. But one point I would like to mention here, when we are doing the Siraveda, sometimes some of the Vaidyas, they are using the syringing method rather than open needle or with the SV set opened method. The difference what I feel is, when we are using a syringe to pull, you are creating a negative pressure, where you are creating a pressure over the venous walls also and semilunar walls also. But when you are doing the classical method by venipuncture or by needle or by SV set, we don't have a pressure. It is the pressure which is built up in the vein that is pushing the blood outside. That means you have put on the tourniquet or the you can use the BP cuff or something where you can block the temporarily the venous return or reduce the venous return so that the Rakta moksha can happen. So that is something which is I would like to share. If you are using the syringe, just like 20 ml and easy to draw the blood, please don't use that. That will further, it will ease in your procedure for a while, but it will cause the problems more. And it will avoid, the Rakta moksha will avoid the formation of clots and further complications because the blood is removed easily. Whenever the blood is removed, there will be quantity loss. Naturally, the body compensates it by diluting the blood. That means once the diluting is happening, that means the viscosity is less, the blood becomes thinner, easier, and it can be transported or easily transported. Some of the cases which we are seeing the best results within 6 to 8 months, we can see that there's a huge transformation which is happening there. Fourth stage, we can say hyperpigmentation or varicose eczema. There is always a confusion patient when comes with the skin problem, especially in the lower limb, especially above the ankle or below the knee. There will be confusion whether it is eczema or varicose eczema. So if you look at the condition, if you see the varicose vein and eczema, definitely can go with that. But you can see that the eczema might be independent also. So that means it will be a pathology or it will be some other relation when compared to the varicose vein. Varicose eczema will happen naturally when there is a varicose vein which is not treated, leading to stasis of blood where the body starts purifying it through the skin because it needs to be purified. Or the other way we can say that the contents of the blood gets sedimented so that they can be transferred out through the skin, or naturally the sedimentation happens so that the clogging happens. There will be a oozing also. There are multiple pathology which can happen there. Here hyperpigmentation, we try to go with the Leech or the Jalauka method because hyperpigmentation which is happening in between the different layers of the skin, Siraveda will not be much more useful because Jalauka can increase the lymphatic drainage too, and it is the pumping mechanism from the very thin layer of the skin where the lymphatic drainage as well as the other venous drainage can be much more easily carried out. Kashaya Dhara or Kshira Dhara. Kashaya Dhara naturally we do when there is an itching and swelling or the thickness of the skin. Sometimes we use Triphala alone, sometimes we use Triphala with Manjista, Triphala with Estimado you can use, or Panchavalkala simply you can use, or similar Kashaya with Kshira. Kshira generally we use wherever there is a more Pitta and Vata involvement. Otherwise maximum we go with the Kashaya Dharas as such. Looking at these two, Rakta Mokshana and Kashaya Dhara, the main thing is to improve the blood circulation and reduce the stasis and a blood purification and thinning. Improve collateral circulation. This is very, very important in case of varicose vein. Improving the collateral circulation. The main drainage or main pathway is blocked so that we can open up the collateral circulation where the circulation is maintained and there will be a less pressure over the mainstream. Ensure blood flow which is fresh so that the swelling reduces easily. When there is a proper channel where the blood circulation happens, swelling will naturally reduce by itself. Some of the hyperpigmentation cases which are treated. Fifth stage we can say that venous ulcer, stasis ulcer or tropical ulcer. When we say ulcer, basically it is much more like a physiological way it is happening from the inside, caused from the inside rather than from the wound. Wound is mostly from the outside which is happening. That means one day the skin was normal, suddenly they started oozing and then get into an ulcer, then the itching was there, the person scratched and it becomes a little bit more. Or he was moving, he suddenly touched some sharp object where the skin opening just happened, then it was not healing, it was continuing. Some of the cases we can see, in both these cases we have done Virechana as a treatment. especially the second one where we see the scale. It was since 4 years the person was suffering, and this took only 3 months to heal. And this is one of the our Ayurveda therapist from Mandya. It happened because he's a therapist and there need to be long standing. And he was treated with once again the Virechana and other external treatment and Jaloka twice. So that helped him to reduce to this condition within 2 months. So when we look at the medicines which we are using, or how the medicines which we need to use to heal the ulcers is that which can promote the angiogenesis. That means the blood vessels has to form when there is a proliferative stage, so that the circulation has to continue, so that the healing will happen much more easily. Antioxidants which are required to reduce the stress level. Whenever the venous return is not happening, that means it's a deoxygenated blood, or we can say that less concentration of oxygen is there, where the cells cannot breathe. It's suffocating. When they're suffocating, they don't function normally. So when you do the antioxidants, that will reduce the free radicals, or it will reduce the oxidative stress. That means it will give much more good oxygen where the detoxification of the blood happens, and the cells can be much more breathe properly or heal properly. It totally improves the microenvironmental which is needed for healing. Most of the time I use this word environment, because environment is a proper environment will give rise to the disease, and proper environment will give rise to the healing. One of my teachers used to give an example that there will be always seed in the mountains, but only in the rainy season they start growing, or if we give the water properly. That means it needs that favorable environment where things can be facilitated easily. So when you create a micro environment which is healing, that means you need to clean the wound, you need to properly take care of the wound, improve the circulation so that the debris is removed properly. There are multiple things which can happen so that the cells starts healing themselves. Reduce the venous stasis, reduce the blood coagulation, and reducing venous damage by helping by physical activity or not doing the causes. So in case of ulcers, we used to clean the ulcers naturally with Triphala, Fanta, and for the healing we use Parantyadi, or if it is a Dushtarana, we try to go with honey. I think most of you are from Coorg. If you get a best honey, I'm not sure that whatever we get is best. I think all of you know that. Because honey is something which is a natural wound healer. When you look at the qualities of honey in Ashtangarudya, it is Shodhana, Ropana and Sandhanakara. What more we need? But we need honey, not the sugar juice or the jaggery juice. So that we need to make sure that, because if we put that, that will lead to the Dushtarana easily. And some cases we use the neem leaves with tila and honey as a combination also, which is best results, where it does the debrisement, where it helps for the microcirculation, and healing process is much more faster. We see that. Some of the cases which were treated, which took almost years also. And this is one of the patients which you are treating right now. This is after a month, this is after second month. This case we have not done Virechana because the financial condition was not so good, but dry leaf dressing and dhara, and then nimba patra kalka along with the honey and tila, which I told, that what we are using here. When this condition, the patient came, it was whole foul smell and unable to stand in the whole treatment room. Whenever we do dhara, it was not responding much. When we started tila and nimba kalka and honey combination, this slough naturally went off. So this is the beauty of nimba patra, honey and tila. Because if you start pulling it, the bleeding may happen and you may injure the micro vessels. So if it happens naturally, that becomes the healing process much more easily. We can see this. And this is the same patient, which I'm seeing the lateral side photo, that you can see the side. That also here he had in Nadirona, or we can say the sinuses, because there is no other opening, and it was led to the calf muscles also. We use the Vic method with the Jatya Taila and Tankana Basma, which is included into that for the Lekana or the drainage. So that has given a good result. It healed completely. When you look at the complications of the varicose vein, lipodermosclerosis is one, but we have not got much patients of this, only 1 or 2 cases. So we got the result, but we are still searching how our medicine is acting there and what may be the probable action. So on that we made some of the Leech, like short term and long term. We have done the Leech therapy and oil applications, which can lubricate and improve the circulation. That's a basic thing, is remove the stasis, improve the circulation, strengthen the vessels, and let the person maintain the lifestyle properly. This is something which you are looking at. And we can see that there is a reduction in the fibrosis also. That means fibrosis is something which we know that fibrous, that's plastic like, a hard mass like. But before it was moist, before it was a normal cell. So the lubrication is the one phenomena which can help it to bring back to the normal. But still it's an hypothesis, because we need to work on these more conditions so that we can come into a conclusion. Cellulite ulcers, we can see that some of the patients comes to us with the cellulitis and ulcers, late ulcer, because thinking that it is part with the varicose vein also sometimes. But we are getting the good results, maintaining the same method, cleaning the area, and most of the cellulitic conditions we use Panchakarma, because itis is more like in pitta, and then we know that cellulitis, it can lead to septicemia and other conditions easily. So whenever you reduce that intensity of heat or intensity of chance of getting into the ulcer or healing the ulcer better, naturally the circulation improves and the swelling reduces to heal it better. Post-surgical venous ulcers, this is also which we are seeing much more commonly. Most of the time it is easier for the patient to undergo operation rather than Ayurveda treatments or any other conservation treatment, because you need to keep an eye on that. Every day you need to do the exercises, or every day you need to take care of using the stockings or crepe bandage, or need not to stand long period and those things. So it's easier for them to go for the operation. I don't say it is bad or good, but the consequence that happens is, if somebody has undergone the operation, it's always they need to be very conscious that the collateral circulations has to be improved. If the collateral circulations is not improved, automatically venous stasis happens. Where the blood has to go, the main drainage or the main trench is blocked. The overflow, spilling will happen naturally. We need to give a direction to that. So stockings is must, exercise is must. Once the person doesn't follow these 2 methods, gradually that will lead to ulcers, and it's very, very difficult in terms of modern or any other methods to treat them, because venous return is not there. But in our treatments, they are also getting good response. But once this is done, once again we instruct them. If they don't follow that increasing the collateral circulation methods, that once again there may be a chance of getting these ulcers. For preventive and to accelerate the healing, the diet, that means naturally we go with something which can not cause us the problem in rakta, or we can say any amla, vidagdha, or lavanarasa. These things we try to reduce. Lifestyles, that is once again it goes with our whole thing, that is job and other things gives an importance, and yogasana and pranayama will be the part of that. All this customized according to the occupation. Sometimes we don't look at the prakriti, we look at the occupation, because it has become the more occupational results, how to help them. So now sometimes I explain to the patients that if they are a factory worker, a teacher, a salesman, after standing for a 1 or 2 hours, I ask them to do busky for 5-10 times. Just find a place where to do it, so that there will be a pressure which is created by the calf muscles and the thighs and the abdomen, so that the circulation happens. Whatever the stagnating thing happened for a 1.5 year, that will be removed much more easily. Or if there is a place where they can lie down and lift the leg at least 3 inches above, that will lead to the drainage much more easier. We can look at some of the exercises which we recommend, and this video So this exercise we normally ask them to do half an hour in the morning and half an hour in the evening, compulsory, because the medicines which we are giving, which we are trying to give, will act only to 50 to 60%, and rest is lifestyle. So that is something which helps exercise to be a part, as we know that Dinacharya Vyayama is a part of that, and Abhyanga is a part of that. This is how we need to incorporate that. And the formulations which we are using, before forming these things, we try to use similarly the things which I explained to purify the blood. We used Kokilakshadi Kashayam, we used Vasaguduchadi Kashayam, we use Kaishara Gugulu, Trifala, Kanchanara, like that many combinations we use. But sometimes we get good results, sometimes we couldn't. So somehow this formulations was done by Dr. Ural for a long period. Now we are starting with the applying that to the different areas also, exploring the other possibilities, and some of the clinical trials has been conducted, as well as the animal trials has been conducted. On the principle, just we are explaining how this formulations is helping us to get rid of the varicose vein or help the people who are suffering from the varicose vein. So special oil which is formulated, we advise them to do the Abhyanga in the opposite direction. It's almost like we can say Udvartana is the opposite to hair direction, but here we say that towards the upward, because it can facilitate the venous return. That's the main intention, and it can help the walls to relax, lubricate and re-strengthen. Here the idea is not the rubbing the oil over the area. It's only where the venous are compressed, but there is no pressure over your muscles. So that is a basic, which is not the muscular. It's not the oil for the massage for the muscles you are doing. It's only the venous what we require. So we ask them to do it for 15 minutes and leave it for 1 hour before they take shower or wash it, or sometimes you can keep it for 2-3 hours also. This improves circulation, restores the elasticity of the veins, and antioxidants which are helping to reduce the stress, oxidative stress in the cells. Restore the firmness of the veins, walls and skin surface, because all of these things are together. If there is a firmness in the skin, that doesn't allow the veins to collapse. If there is a vein firmness, that doesn't allow to vein walls to collapse. So these are all related. And reduce the strain in the muscles. So whenever you do the massage, naturally the muscles also get benefit from that, so that you feel much more comfortable with the circulation, where the heaviness is reduced by naturally. And our multi-dimensional effect of the internal medications like syrups and tablets to eradicate the basic pathology. We can see that they're acting as a blood purifier, blood thinner, and help to dissolve the clot, mobilizes stagnated blood in the veins towards the heart. Towards the heart, naturally it happens. Whenever the thinning happens and the blood purification happens, mobilize is naturally it is happening. Enhance the optimum functions by stimulating the collateral circulation. This is we are achieving with the medicine, but more with the exercises, because there is no medicine as such to increase collateral circulation. It's only the exercises which can increase much more easily. And oxidants, which I told you before. And as I told you, you look at the pathology of the liver, because as I told you, Mula. So we need the functions of the liver to be optimized and remove the toxins or blood purify, reduce the stasis. And strengthening the muscles, that too, we need to strengthen the muscular layer in the veins so that the elasticity of the veins can be regained, so that the semilunar walls in the veins can regain their strength and ability to function normal way. Looking at the prevention and precautions, cut the causes of prevention, everybody knows that. Don't sit or stand for a long period. Treat constipation, because most and easily everybody is getting to the constipation nowadays because of several reasons. So treating the constipation is the main important things. Reduce weight and obesity. Do enough exercise. Stop smoking. Foot elevation during sitting and sleeping. Sleeping foot elevation, I don't think it has much more benefits, but generally we say that in a sitting position you can just extend your leg and put on a sofa or like a chair which is almost equal to your hip level. But if you look at that, the circulation can happen easily to your groin. There is a twist. So there it becomes the little pressure which is created over your femoral vein. It is like a barrier, or you can say that is obstructing the flow. So sleeping position is the best, where you can get the maximum benefits. Oil massage in the upward direction to the feet. That need not be our oil. You can go with the Sachara, Tela, Narayana, Dhanvantara, or anything which is required to them. Wearing the stockings or tight socks or crepe bandage whenever they are traveling for long distances. If a person is prone to varicose vein, it may be in the first, second, or third degree, whatever it is. Physical activity should be regular. It can be any form of stretching, walking, yoga, anything it can be. Because regularly it has to happen. It has to be, because yoga is a part, exercises is Vyayama is a part of Dinacharya. And sometimes we say that I'm working too much hard in the field, or I'm working too much of physical activity. Should I need exercises? That is a strain which you are taking. When you say Vyayama, it is Visistayama. That is where it has certain things where all the body components are getting benefited in coordination, not in one direction. If you have already the varicose vein manifested, or if you have a stasis or the ulcers, try to avoid long traveling, and if needed, you use the train. That is most better. And if you have a problem, periodically consult the doctor, because once it's set into a ulcers, that's an alarming sign, and that's a tedious job that will take more time to heal. I think all of us know Masanamasa Garbha Upachara, where the 8th month, where we give the enema, Abhyanga, Dhara, many things are done, because as I told in the beginning also, pregnancy is not pathology, it is physiology. If you don't maintain the physiology properly, that might lead to the pathology. So all of you know this, what to do and other things. We have branches different parts of the Karnataka, and we have branches in Pune, Hyderabad also.
So far, we could see the effective management of varicose vein through unique formulations of Dr. Ural's varicose vein care. As we know, prevention is better than cure. The same good holds for the varicose vein also. Because once the varicose vein process starts in a person, it gets complicated and lead to the amputation also. Join hands to make the society free from varicose vein. Let reach the needy in time. Thank you.